Hey, Dave with Line Therapy here. I wanted to share a research article that I recently found and share some of my thoughts on it. It's an interesting topic. It's titled Back Pain in Adolescent Idiopathic Scoliosis, Frequency and Risk Factors. It's actually a really common discussion that we have with our patients, and surgeons also have this conversation with their patients a lot on how often back pain is there with scoliosis and spinal deformities, and it's interesting because we see a broad spectrum. I have surgeons who will tell patients that scoliosis doesn't cause back pain, which is true. If it did, then everyone with scoliosis would have back pain, but it kind of negates the fact that scoliosis can contribute to back pain. And I think that's something that we really need to be specific about, because I see back pain in my scoliosis patients all the time. Sure, we see back pain in the general population all the time as well. So we have to be careful on the conclusions that we're making. But this research article, it really looks at some specific factors and correlating that with those that have back pain. So let's dive into it a little bit, and then we can talk a little bit more about what it's talking about. So the idea behind this was looking at adolescent idiopathic scoliosis. So this didn't look at adults with scoliosis, looking at specific variables and seeing which patient characteristics had a higher risk of back pain in adolescent idiopathic scoliosis. So their participants were ages 10 through 17. They being diagnosed with adolescent idiopathic scoliosis, and they had 891 AIS patients that were included in the analysis, which is a fair number. That's a pretty good sample size. It was predominantly female, so 73% female, and there were 57% of those that were Medicaid. So they looked at if insurance variables played into this. They looked at what type of scoliosis they have. They looked at where the back pain was, and a few different factors. So they looked at some cool things. So when they looked at how many of those 891 patients had back pain, they saw that they had 48.5% of those had back pain. So if we just extrapolate that to the population, that's half of the patients with scoliosis could report back pain. And it's talking about in here, I'd have to look up their reference for this, but they're saying the prevalence in just adolescents in general without scoliosis is 33%. So if we compare those two, there's a higher percentage of back pain in those with scoliosis. So that's important to note. And they looked at quite a few different things. They looked at the majority of the pain that was reported was in the lumbar regions, so 56% of back pain in adolescents with scoliosis was in the low back, and less commonly 39%, which is actually still a high number, was in the thoracic spine, and the scapular region was 8% of those who reported back pain. So the low back pain is the most common, then thoracic, and then scapular pain, which is what we see traditionally in the clinic as well. It talks about there's no association was observed between pain presence and vitamin D deficiency. That's interesting. And the major curve magnitude, it also didn't correlate with the presence of back pain, which is interesting. You'd think that a bigger curve would have a higher prevalence of back pain, but that really wasn't the case. And the gender of the patients wasn't really correlated with who had back pain and who didn't. The results showed that the older patients, so the older the patient and those insured by Medicaid and those with higher risk scores, which also is kind of with the older patients, were more likely to report pain scores. So It's really interesting when we get into different factors that influence back pain. If we think back to scoliosis and why we have back pain with scoliosis, I mean, it's an imbalance, it's an asymmetry of the spine. We see imbalances of the paraspinal muscles, we see tightness different places, we see an imbalance with the trunk over the pelvis. So it makes total sense to me why we have more back pain in scoliosis patients. But if we look at, there was a higher prevalence of back pain in those that have Medicaid insurance, that brings in a few different factors. And I don't want to go deep into this because we would have to go pretty deep into this, but I see that in my practice. Those with Medicaid insurance who are lower socioeconomically, they probably have other comorbidities, or they may, there are other factors that would need to be explored with this, but they have a higher prevalence of back pain if they have scoliosis. So there's some other factors than just the imbalance. In their conclusion, they talk about pain was more prevalent among patients over the age of 13. So that's interesting. So the older patients over 13, there's a higher prevalence of back pain. Those with heavier body weight, that makes a lot of sense to me, because those with heavier body weight, they have more force, but they're also probably not quite as active as those with less body weight. That doesn't always fit, but you could make that correlation. And those insured by Medicaid, which we already talked about. Pain was most commonly reported in the lumbar region, especially among patients with lumbar curves. So if you had a lumbar curve, it's more common to have pain in the lumbar region, which also makes sense. This information can be helpful in counseling AIS patients, though further investigations are needed, especially to determine the underlying cause of back pain in AIS and to elucidate the discrepancy in pain between patients with Medicaid and commercial insurance. I think that would be a really interesting research article, but I feel like that would have so many variables to determine why we have this difference between commercial insurance and Medicaid insurance and why they have more pain. I mean, I have my opinions, but they're just opinions. They would need to be studied and looked at in more detail. So I think the biggest takeaways from this article, 3 things. One is that there is more back pain in adolescent idiopathic scoliosis. About half of them we can anticipate will have back pain, and at least if we're extrapolating from this study, I didn't see. So insured by Medicaid was 57.8% of this population that they looked at. So that may actually be skewing those numbers if we have a higher prevalence of back pain in Medicaid patients and we have a higher cohort within our sample size of Medicaid, that could skew those. So I would say back pain is probably in 40 to 50% of my scoliosis patients, and so that kind of fits along with this. So we have back pain with scoliosis. If you're told that scoliosis doesn't cause back pain, take a step back. Yeah, it doesn't, or everyone with scoliosis would have it, but it doesn't mean that scoliosis isn't contributing to your back pain. And I think that's an important point to remember. The second thing, there are a lot of other factors that affect back pain with scoliosis. I think back pain in general. I wonder if we took a sample of Medicaid patients and we saw what the prevalence of back pain just in general was, independent of scoliosis, if we would see that higher as well. So there are other factors that are playing into the back pain with scoliosis, whether that's nutritional, whether that's psychological, whether that's socioeconomic, things like that can play into it. And I think we need to look at those things. And then there are other factors like a higher body weight and activity can be maybe not a predictor for back pain, but those that have a higher BMI or heavier can have more back pain. So activity, strengthening, and then if we can figure out that piece with Medicaid, trying to figure out how we reduce back pain that way as well. And if you're a provider, I would love for you to take away from this that if a patient comes to you and says they have back pain and they have scoliosis and they ask if it's because of the scoliosis, don't just tell them no. Don't tell them that scoliosis doesn't cause back pain, because it then invalidates what they're feeling. They feel like they shouldn't have back pain. Empathize with them a bit. Tell them that there is a high percentage of back pain in those with scoliosis, and let's address the imbalances with that. I see great results with the Schroth method, with strengthening, with manual therapy, with all those things. If we address the curve in an asymmetric way and their back pain improves, then the scoliosis was probably contributing to their back pain. So overall, a good research article. I think there's some other things that can be done with this as far as research goes, and I'm excited to see what comes out in the literature in the future. We have a lot of success with treating back pain in my clinic with those with scoliosis, and I really feel like it can be helpful rather than just accepting that you have back pain and you have scoliosis. Let's do something about it. Let's treat those imbalances and increase the stability of the spine so that you can tolerate that. Along with that, we can help reduce the curve and reduce progression of the curve. So there's my plug for the Schroth method and my plug for scoliosis specific exercise. So thanks for watching, and we will do more research article reviews as they come out. There's a lot coming out recently, so I'll have a lot of opportunities to do that. So thanks for watching, and we'll see you next time.